Today I'm going to discuss about the urinary system. It's also called as excretory system. The urinary system is also called as excretory system. So there are many anatomical aspects. There are many points you have to know. Physiological aspect, there are many points that you should be knowing. Okay, the kidney has to be studied in a gross manner as well as microscopic aspect. Okay, and there are more physiological aspect that is involved to filter the blood. Okay, so let's start. So we will be studying about two kidneys, then the urinary bladder, then the ureter and the urethra. Okay, that's male urethra and the female urethra. Okay, so now coming to the objectives. So we will study about the structure and functions of urinary system, then describe the function of particular regions of nephrons. Okay, nephron has different parts, so we will discuss about the Bowman's capsule, proximal convoluted tubule, Henle's lobe, distal convoluted tubule, then the collecting duct, etc. Okay, then explain the physiological mechanism involved in the urine production. This production of urine is a very important thing. There are three stages. Okay, simple filtration, then selective reabsorption and excretion. There are three stages. In these three stages, how the process is taking place, you know. Okay, relate how renal control of blood fluids level integrates with the neural and hormonal regulation of blood flow and blood pressure to govern the cardiac output. Okay, then discuss the normal properties of urine and its abnormal components. Okay, so the main role in the body is to maintain body's internal environment. Okay, so for that there are many points you have to consider. What is the normal internal environment? Like for example, normal sodium level, normal potassium level, normal body fluid level, normal hormonal level. Everything has to be considered. So in that case, regulation of water and electrolyte balance, that is done by the kidney. Then excretion of metabolic waste product like foreign chemicals such as drugs, pesticides, food additives, hormone metabolites, all these things is done by the urinary system. Then regulation of arterial pressure. For example, if there is more fluid, the pressure in the arteries will increase, isn't it? So thereby the excretion of urine is maintained by the renin and sodium balance. Then regulation of acid base balance. Okay, so the blood pH is 7.4. so this kind of pH has to be maintained by the kidney. For sometimes you drink more citric juice. Okay, so that makes the blood acidic. Then regulation of erythrocyte production. You know, in the bone marrow there are this bone marrow is the place where the blood cell production is done. So the kidney is the organ that is secreting erythropoietin hormone that goes to the bone marrow and activate the RBC cell production. Okay, then regulation of calcitrol, vitamin D3. Okay, then gluconeogenesis. Okay, during the prolonged fasting time. So all these are done by this urinary system. So in the urinary system we will study about the kidneys, two kidney, right kidney and left kidney, two ureters, one urinary bladder and one urethra. Okay, so this urethra is different for male and this urethra is different for female. This is what you will study in the urinary system. Okay, so coming to the urinary system in the female, up to bladder it is common for both male as well as the female. Okay, up to bladder this urinary system is common for both male and the female. You know, the kidney is placed in the retroperitoneal space. This is what you have to understand. Kidney is placed in the retroperitoneal space. So you have two bean-shaped structure, and on the kidney you have the adrenal gland like a crown. Okay, so now I will show you the different parts of the kidney and I will explain. Just know these are all the structures you will study. Right kidney, left kidney, urinary bladder and the ureter and urethra. Okay, so coming to the location, as I told you, this is the vertebral body, and here you have the peritoneal sac. In the posterior aspect of the peritoneal sac, you have the kidney. This space is the retroperitoneal space, where the duodenum, kidneys, blood vessels, aorta, inferior vena cava, or ureter, all these organs are present. Okay, so it's a bean-shaped structure. Okay, it is present between T12 to L3 vertebra, whereas the right kidney is slightly lower. I will show you that. Okay, then the adrenal gland is on the top. So if you, this is abdomen. Okay, now we are drawing an imaginary line in the middle of the clavicle, and one line above the umbilicus and one line below the umbilicus. This is dividing the abdomen into 9 parts. Right hypochondrium, left hypochondrium, right lumbar, left lumbar, right iliac fossa, left iliac fossa, then epigastric region, umbilical region, hypogastric region. Okay, these are the 9 different regions. So in that, in the right lumbar and the left lumbar area, the 2 kidneys are present, and especially more posterior as well, because anteriorly you have the peritoneal sac, so it is in the posterior aspect of the peritoneum. Okay, so generally when there is a renal calculus formation, the pain originates in the posterior aspect of this right and the left lumbar region. Okay, so here you can see this is a thoracic cavity, this is a abdominal cavity, and this is a pelvic cavity. So the kidney is located here in the posterior aspect of this pelvic peritoneum. Okay, so let's see this kidney in the 3D model, so that you will be able to. You see here is the bean-shaped structure. Okay, and this is the right kidney, and this is the left kidney. This is the right kidney, and this is the left kidney. So what happens here? This kidney is present exactly at the T12 vertebra to L3 vertebra. Okay, so in fact the right kidney is lower than the left kidney, because the location of the liver is compressing you can see here, the liver is compressing the right kidney, so the right kidney is little bit lower than the left kidney, you can see. Okay, the right kidney is little bit lower than the left kidney. Okay, so now what you have to understand here is this kidney is covered by a fascia. Okay, on the kidney there is a thick layer of connective tissue, 2 layers. Okay, one layer is the fascia, and also more amount of fat bed. Okay, there is a fascia like this that is covering the kidney. Okay, so this fascia is called as Gerota's fascia. This fascia is called as Gerota's fascia, and there are more amount of fat. This is the perinephric fat bed. We call it as perinephric fat bed. Okay, so perinephric fat bed. So why I am telling this? Because there are patients who are suffering with polycystic kidney disease, that is fluid packet around the kidney. Okay, this polycystic kidney disease takes place in this Gerota, in the perinephric fascia, that is Gerota's fascia. I'll show you a picture. The outer cortex has more number of water pockets. Okay, so this disease is called as polycystic kidney disease. You can see the outer fascia is swollen because of fluid collection. This is common in some patients, and there will be severe amount of pain. Okay, this condition is called as polycystic kidney disease. Okay, so now if you look at the longitudinal section of the kidney, if you look at the longitudinal, above the kidney you have this adrenal gland. You have the adrenal gland, you can see here. You see, this is a suprarenal gland, that's called as adrenal gland. if you look at the blood, this is the outer curvature and its inner curvature, and this junction is called as a hilum of the kidney, where the ureter is coming out, and you can see the entry of this renal artery. You can see the entry of renal artery. This is the renal artery. Okay, this is the main renal artery that is entering into the kidney, and also the renal vein. Okay, you see here, this is the renal vein that is entering into the hilum, and renal artery that is entering into the vein. After entering inside, they further divide into branches. Okay, so let me show you. Okay, you see the renal vein divides into multiple branches. Okay, there are different branches, arcuate vein, segmental veins, like that. Even the renal artery is also dividing into same multiple branches. Okay, so I will select both the vein and the artery. You see, this is how the blood vessels enter into the kidney hilum, and they distribute into different segments. Okay, they distribute into different segments. So there are different names for segmental arteries, arcuate arteries, like that. Okay, so now along with that, you have this ureter also. You see this ureter, they divide into pelvic calyceal system. This ureter, they divide it into pelvic calyceal system into the inside the kidney, in the inner aspect of the kidney. Okay, so this is how they go and spread inside the kidney. In this way only they go and spread inside the kidney. Now I am going to show you the cross section of the kidney, longitudinal section. So for that, when we cut the kidney in the longitudinal section, I can okay, when we cut, this is called as a pyramids. And this area, this junction is called as a renal pelvis. Okay, so these are the calyces of the ureter, and this is the minor calyx, and this is a major calyx. So minor calyx collects together to form the major calyx, and then they join to the renal pelvis. Okay, so this pyramid like structure is called as the it is present. You know what, there are 1 million nephrons in each kidney. The collecting duct of each nephrons, they come and open in this this minor calyx, so that the urine will be taken through the ureter. Okay, urine will be taken through the ureter. Okay, so this is how the blood vessel divides. Urinary so all the remaining area will have this outermost layer is called as a renal cortex. And these are the renal columns. Okay, so these are different parts of the kidney. This is the major structure of the kidney. Okay, now we are going to check about each kidneys. So each kidney weighs around 150 grams. Okay, which is 11 by 6 into 3, that is 11 centimeter long, 6 centimeter wide, and 3 centimeter thick. Okay, it's the size of the clenched fist. Indentations called as hilum. This is the hilum, where the ureter, renal artery, and renal vein enters. Okay, and the outermost layer is the cortex, and the inner area is called as the medulla. Okay, medulla is divided into 8 to 10 renal pyramids. These are the renal pyramids you can see here, and pyramid base is called is the papilla. The base of the pyramid is called as capilla, to which the minor and the major calyx are connected. Okay, so all the urine that is draft, we call it as urine efflux. So every minute there is urine efflux continuously, and those urines comes through the ureter in this way. Okay, and reaches the bladder. So coming to the supportive tissue, the outer connective tissue of the kidney, you have the renal fascias. Okay, This is outermost, and this is called as a gerotas fascia. We call it as gerotas, anchoring the outer layer of dense fibers into fibrous connective tissue. Then there are perinephric fat bed. Okay, there is more amount of fat that is present around the kidney to act as a cushion. Okay, then fibrous capsule prevents the spread of infection. In this place, this capsule extends and forms a kidney polycystic kidney disease. Okay, then the renal cortex you have seen, that is a granular appearing superficial organ. The renal medulla composed of cone-shaped pyramids separated by renal columns. Okay, renal pelvis is the place which is funnel shaped, and that tube continues as a ureter. Okay, so pyelonephritis means inflammation of this renal pelvis as well as the kidney due to some infection. Okay, so nephrolithiasis means formation of stone. Okay, so we have to understand this, where the stone is formed. Nephrolithiasis. Okay, you can see the stone is formed in this junction. Okay, so once the stone detaches from this place and start to move, the ureter will go in for spasm. When the ureter is in spasm, we call it as renal colic. Severe amount of pain will be present. Okay, so you can see there are many big stones. Okay, or there are different types of stone. For example, staghorn calculi. If you see this stone, you see this is a urinary stone. This is the size of the stone. This is a stone actually. This is not ginger. Don't think that this is ginger. This is a stone that is formed in the renal pelvis. Complete urine will become complete kidney will become non-functional. Okay, so there is another one, staghorn calculus. See, this much big stone can develop in the kidney. Not all the people will have a kidney. And when we do ultrasound, I have seen a lot of cases with horseshoe kidney. Okay, that's a congenital abnormality, horseshoe kidney. Okay, out of 100, some 4 or 5 people I have seen. You see, this is a horseshoe kidney. The kidney is like a horseshoe. Okay, so that means during the formation, the kidney will not detach separately, so they unite, but this will be functional. The patient also may not know that they are having horseshoe kidney. Okay, so at some stage incidentally they will find that the kidney is like a horseshoe. This is a horseshoe kidney. Horse. Okay, so this also you have to know, the horseshoe kidney. Okay, so let's go to the next slide. Coming to the transverse section, this is a longitudinal section. Okay, as we know, how this is the outer cortex, and this area is the renal medulla. In the medulla you have the renal pyramids. These pyramids are connected to the minor calyx and the major calyx, and this major calyx connected to the renal pelvis, and this renal pelvis continues as a ureter tube. Okay, so this is the longitudinal section that I have shown you before. Okay, now let's do the blood supply to the kidney. As I told you, the inferior vena cava gives a branch called renal vein. Let's start from the artery. Okay, so this is aorta. The aorta gives a perpendicular branch, paired branch. Okay, that is called renal artery, that is entering into the kidney and taking the name as segmental artery. This is the segmental artery. Okay, so this segmental artery further divide into interlobar arteries. These are the interlobar arteries. This interlobar arteries divides into arcuate artery. This is the arcuate arteries. Okay, so this you can see the arcuate arteries. The arcuate artery further divide into cortical radiate artery. These small branches are called as a cortical radiate artery. Okay, then they go into the Bowman's capsule as afferent arteriole. So this is macroscopic view. When you come to microscopic view, you can study about the structure of nephron, part of nephron. There you will understand what is afferent arteriole and the glomerulus capillary. Okay, and this is where the filtration taking place. Then it exits out as afferent arteriole. Then it takes the name as the vasa recta. This vasa recta collects as a cortical radiate vein. This radiate vein condense to form the arcuate veins. Then arcuate veins condense to form the interlobar veins. Then the interlobar vein connects to form the renal vein, and then they come and join to the inferior vena cava. This is how the blood vessel network is present inside the kidney. This is how the blood vessel network is present inside the kidney. So let's go to the microscopic structure of the kidney. Let's move to the microscopic structure of the kidney. Okay, as I told you, there are 1 million nephrons in each kidney. There are 1 million nephrons in each kidney. Study says that 10% of the nephron is enough to produce enough amount of urine. Okay, 10% of the nephron is enough to produce enough amount of urine. This is what the study says. So now we have to study the structure of a nephron. Now we have to study the structure of the nephron. So if you look at the nephron, this nephron has different parts. There are different parts of the nephron. It's like a small tubular structure. You have to carefully note this. Okay, in the tip of the nephron there is a cup like structure that is called as the Bowman's capsule. That's called as the Bowman's capsule. Inside the Bowman's capsule, the afferent arteriole enters and forms more amount of capillary beds. Then the afferent arteriole comes out. The afferent arteriole is coming out. Okay, so this is forming the juxtaglomerular apparatus. I will tell you what is that, because you have to understand how the blood is filtered in the urine formation, then how it is reabsorbed, and how this hormonal action is taking place. Okay, so there are many concepts you need to understand in this junction. Okay, I will show you in a different picture and I will explain you. Okay, you will understand clearly, don't worry. This collectively it's called as a Bowman's capsule. Okay, so the blood capillaries inside this is called as the glomerulus, and the whole complete set is called as a Bowman's capsule. So now this tube is continuing as a proximal convoluted tubule. It is continuing as a proximal convoluted tubule. That means what? The blood fluid that is filtered just passes through this tube, and then it takes the name as the loop of Henle. Okay, this tube name is called, from this junction to this junction is called as Henle's loop or loop of Henle. Okay, then this tube is taking the name as distal convoluted tubule. Okay, so that means that all the fluid that is coming through this tube, like going like this, and then it is taking the name as distal convoluted tubule. Finally, this distal convoluted tubule joining the collecting duct. This collecting duct opens into the pyramids, and which is connected to the minor calyx. So this is the structure of a nephron. Now let us see about this renal corpuscles. Okay, that is the Bowman's capsule. Here what you see, this is a cut section of the Bowman's capsule, and what you see, these are all the cuboidal epithelial cells having brush borders. It's having minute brush borders. Okay, it is having brush borders, and this is the afferent arteriole coming inside the Bowman's capsule and then coiling, forming small capillaries and then coming out. Okay, Now what happens, this is the place where the first stage of urine formation is taking place. See, there are three stages I told you: simple filtration, selective reabsorption, and excretion or secretion, whatever it is. Three stages. So the simple filtration step is taking place here. Okay, these glomerulars, this is the capillaries, are tuft of capillaries with fenestrated endothelium, highly porous, allows filtered formation. That means what? The blood along with the RBC cells just blindly filters everything here. RBC alone will escape, remaining all the fluid will filter in this. Okay, that's what we taking place in the Bowman's capsule. This is what is taking place in the Bowman's capsule. So this what happens here, you have to understand the juxtaglomerular apparatus, because there are different types of cells. I will show in a different picture and explain, okay, which is helping in the kidney to maintain the pressure. So this juxtaglomerular apparatus cells, they decide how much urine should be filtered. I will come to that. Okay, so now you have the glomerular, which is a cup shaped hollow structure surrounding the glomerulus. Okay, now the glomerular capsule has parietal layer, which is made up of simple squamous epithelium, visceral layer having highly branching epithelial cells. Extensions terminate to food process that cling to the basement membrane. Filtration slits opening between the food process allow the filtrate to pass into the capsular space. Okay, so now you have to closely observe here. So we are taking one Bowman's capsule, and you can see the blood is passing through these capillary beds. Okay, so this layer separates blood in the glomerulus from Bowman's capsule. So what happens? Single celled endothelium is present, basement membrane is present, and it is a podocyte cell, that is made up of this Bowman's capsule. So here this is the juxtaglomerular apparatus. So what happens when the afferent arteriole enter, the Henle loop structures here, and there are cells that is deciding the amount of urine to be filtered. Okay, so all the RBCs, everything, they go inside here and start to go through this proximal convoluted tubule. Here is the place where simple filtration of urine is taking place. Okay, so the remaining RBC cells will come in this efferent arteriole. So here what is it? It is filtering the water, it is filtering electrolytes, it is filtering the WBC cells, it is filtering the all the bilirubin, it is filtering proteins in the blood, that is fibrinogen, clotting factor, everything is filtered here, and those fluid passes through this brush border epithelium. That passes through the brush border epithelium. So this let's coming to renal tubule, that is a proximal convoluted tubule. So loop of Henle and the distal convoluted tubule. The it is 3 centimeter in length. The proximal convoluted tubule is close to the renal corpuscles. This is a loop of Henle, and that is continuing as a distal convoluted tubule. Distal convoluted tubule. Okay, and this distal convoluted tubule joins to the collecting duct. The collecting duct is contain two types of cells. Principal cell maintains the body's water and sodium balance. Intercalated cells, which in that you have type A and type B, which maintains acid base balance of the blood. Okay, so this collecting duct is a place where all the filtrate comes to the nephron. Okay, so different types of nephrons are there. Cortical nephrons are there, so in fact 85% of the nephrons are present in the renal cortex, and 15% of the nephrons are present in the renal medulla. Okay, this is what you have to know. 85% of the nephrons are present in the renal cortex, and 15% of the nephrons are present in the renal medulla. Okay, now the coming about the nephrons, you can see this is the nephron, where the renal arteriole enters and forms the capillaries and comes out as renal venule. Okay, so here you can see lot of veins that is present around the loop of Henle, because what happens here, this in the first stage of urine formation, every fluid is filtered, and the proximal convoluted tubule, loop of Henle, and the distal convoluted tubule decides what to be reabsorbed in the second stage of urine formation. That is the selective reabsorption stage. That is the selective reabsorption stage. Okay, so this is the stages in the urine formation. So now let us see about the juxtaglomerular apparatus or juxtaglomerular complex. Okay, it is one per nephron, involved modifying portions of distal portion of ascending limb of nephron loop and the afferent arteriole, important in regulation of rate of filtrate formation and blood pressure. So this, as I told you, the juxtaglomerular apparatus is the main junction to maintain the blood pressure in the body. Okay, kidney just cannot simply filter all the urine, and it cannot show you. Okay, so now I will like to show you another picture to have a better understanding for you. Okay, so in this picture, if you see, this is a Bowman's capsule, and this is afferent arteriole, and this is the efferent arteriole. Okay, the blood comes to the afferent arteriole, and it is spreading in the like a dividing into capillaries, and then forming the efferent arteriole and exiting out. So here what happens here, in the entry point you have this juxtaglomerular cells. Okay, these cells senses how much amount of blood pressure is there in the blood vessel. If there is more blood volume, then these cells will act as a mechanoreceptors, like mechanical receptor cells, and then decide that okay, more amount of urine have to be filtered. If these cells senses less amount of blood volume, I mean less amount of pressure, it will understand that there is less amount of blood volume in the body, so it will not allow more amount of urine to be excreted. Okay, and you know, at the neck, this cells, this is a distal convoluted loop of Henle duct. There are some cells that is called as macula densa cells. Okay, so what happened, I cut this loop of Henle and keep here. Okay, in the loop of Henle there is some cell called as macula densa. These cells are acting like a chemoreceptor cells. Okay, so these cells will decide that the urine is acidic, the urine is alkali, and so it depends to filter more amount of uric acid or to decide whether to filter more amount of sodium or potassium accordingly. So these macula densa cells acting as a chemoreceptor cells, and the juxtaglomerular cells, they are acting as a mechanoreceptor cells, both of them deciding how much amount of urine has to be filtered and how much amount of salt has to be filtered. All these stuffs are decided by these two types of cells, that is macula densa cells and the juxtaglomerular cells. So this is the juxtaglomerular apparatus. Okay, this is the juxtaglomerular apparatus. Okay, if you see here, this is the macula densa cell, and these are the juxtaglomerular cells. Okay, So now you hope you understood about the juxtaglomerular apparatus. Okay, so as I told you, in juxtaglomerular apparatus you have the macula densa cells that is present here, and the mesenchymal cells and the renin secreting cells. Both are these macula densa cells acting as a chemoreceptor cells. Okay, mesangial cells are modified smooth muscles control surface area for filtration, and the renin secreting cells, they feel the pressure. This is the renin secreting cells, okay, that is acting as a mechanoreceptor cells in the afferent arteriole. Okay, so this is how the juxtaglomerular complex is working. Maybe you can click this YouTube link and watch. Okay, next coming to the for urine production. So there are three major processes in urine production. One is glomerular filtration, it's also called a simple filtration. Then tubular reabsorption, also called as selective reabsorption, and tubular secretion or excretion. These are the three stages of urine formation. So almost 180 liters of fluid process in 24 hours, and only 1.5 liters of fluid leaves the body as urine in 24 hours. As I told you, there are three stages. Stage 1, that is the glomerular filtration, that is taking place in the Bowman's capsule. Then the tubular reabsorption stage is taking place in the proximal convoluted tubule and the loop of Henle, and tubular secretion is taking place in the distal convoluted tubule. So these blood vessels are running in parallel to the nephrons, and they start to absorb, okay, whatever fluid is needed, that is selected by the nephron and it is absorbed back. Okay, so coming to mechanism of urine formation, the first stage, that is a simple filtration, also called as a glomerular filtration. It is a passive process, no energy is consumed. The glomerular filtration rate is a volume of filtrate formed each minute by the glomeruli of the kidney combined. The normal GFR rate is 120 to 125 ml per minute. Okay, so that is 1200 ml of blood per minute. Plasma is 650 ml. Out of this have its filtrate. Then plasma proteins remains in the blood, maintains colloid osmotic pressure to prevent loss of water to capsular space. Okay, so this is the filtrate membrane. This is the capillary bed, that is the Bowman's capsule, and this is the inner aspect of the Bowman's capsule. Okay, so just it is blindly filtered. Everything is blindly filtered by the process called osmosis. The process called osmosis. Okay, so pressure that affects the filtration are outward pressure promotes filtrate formation, hydrostatic pressure in glomerular capillaries, then chief force pushing water solutes out of the blood, quite high, 55 millimeter of mercury, because efferent arteriole is highly resistant vessel with the diameter smaller than the afferent arteriole. Okay, so the pressure that affects the filtration are inward force inhibiting the filtrate formation. Likewise, when less amount of blood flow to this afferent arteriole, then here also the filtration is reduced. Okay, then colloid osmotic pressure in capillaries. If the protein level is low, then the osmotic pressure also decreases. Okay, then net filtration pressure, it also depends. These are the three factors that have the effective filtration. One is hydrostatic pressure, colloidal osmotic pressure, and the net filtration rate. Okay, then the GFR, that is glomerular filtration in clinical area, this is clearly monitored. There are some tests which to measure the GFR rate. Okay, as I told you, 120 to 120 ml of filtration is done per minute. Okay, so glomerular filtration rate is directly proportional to each of the following, that is NFP, that is primary pressure, is hydrostatic pressure in glomerulus, total surface area available for filtration, glomerular mesangial cells controlled by contracting, then filtration membrane permeability much more permeable than other capillaries. So these are all the factors that is playing a role in glomerular filtration rate. Then what is the renal clearance? It refers to the volume of plasma that is cleared of the specific substance in a given time. That is the renal clearance. Inulin is used as a clearance standard to determine GFR rate since it is not reabsorbed. Okay, if the clearance value of the substance is less than that of inulin, then some of the substance is being reabsorbed. If the clearance value is greater than the inulin clearance rate, then some of the substance is being selected. A clearance value of 0 indicates the substance is clearly reabsorbed. Okay, so now regulation of glomerular filtration, one is by intrinsic control. Okay, so there are two types of auto regulation. One is myogenic mechanism, another is tubuloglomerular feedback mechanism. So these are the two mechanisms where the intrinsic control is maintained. Okay, next let us speak about the myogenic mechanism. The smooth muscle that is present in the juxtaglomerular apparatus gets contracts and stretched. Okay, so it increases the BP. In increased BP, muscle stretch, then constriction of afferent arterioles and restrict blood flow into the glomerulus. Protects glomeruli from damaging high blood pressure. The decreased BP dilates the afferent arterioles. Both help maintain normal GFR despite normal fluctuations in blood pressure. Okay, so this is the myogenic mechanism. So what happens here is, even if the pressure is less or high, the glomerular filtration rate always remains standard. But when reabsorbing all the required fluid, there is a place where the decision is taken whether it has to absorb all the filtered fluid back, or it has to be excreted out as urine. Okay, so then next mechanism is tubuloglomerular feedback mechanism. What happens? The flow dependent mechanism directed by macular densa. As I told you, macular densa is a mechanoreceptor cells that decides the flow dependent, and also it responds to the filtrate of sodium chloride concentration. Okay, if glomerular filtration rate increases, then filtrate flow will increase, then reabsorption will decrease, then high filtrate of sodium chloride level will take place. Okay, the macula densa produces vasoconstrictor chemical. Okay, so these chemicals will go constrict the afferent arteriole and decrease the flow to the kidney, and thereby the glomerular filtration rate is decreased. Okay, and gives more time for sodium chloride to be reabsorbed. Okay, so this is the tubuloglomerular feedback mechanism. So two mechanisms you have to understand. One is myogenic mechanism that controls the glomerular filtration rate, and tubuloglomerular feedback mechanism that controls the glomerular filtration rate. Okay, how this glomerular filtration is regulated? So this we will see now.